I am currently in treatment for Lyme disease and a whole slew of co-infections and mycotoxic poisoning, which is mold toxicity. I was diagnosed about 3.5 months ago, and I've been in full treatment for about 3 months now. My protocol includes a number of strains of antibiotics and botanicals, hormone support, supplements, IV therapy, colonics, infrared saunas. So I'm working with an LLMD, a Lyme literate doctor who's actually an internist and a naturopath. I'm sharing because throughout this process for me, the online resources of YouTubers and other bloggers and vloggers has been so helpful. Being able to watch and listen to other people go through this, which seems so elusive at times and unpredictable, feels so important that we share. So if you're watching this and you are also someone who's sharing online, thank you. Yeah. I'm in a place right now of confusion. My blood work, which gets done monthly to see how my body is handling treatments and healing, showed really high elevated levels of amylase and lipase, which is the pancreas being agitated or at this point possibly having permanent damage. So I've been immediately taken off all antibiotics. I was very fortunate to be diagnosed quite quickly, which I know is not always the case for people. It takes sometimes years. They treated me quickly as well because my symptoms have manifested quite neurologically, which you're seeing through my speech and the tremoring. It comes in waves. Sometimes it's more intense. Sometimes I do find stillness in my body and ease in my speech. But it's elusive, comes and goes as it pleases. Certainly treatment can trigger it, and stress and overstimulation as well. Sometimes that means that my limbs don't work also, or I have trouble breathing. On the regular, I'm tired, very exhausted, and in degrees of pain at all times. I know that as fortunate as I was to be diagnosed and put into medical care so quickly is rare. But at the same time, the clinic I'm at is very, very overwhelmed with patients and has a huge waiting list, and they're not paying attention. Even the blood work that I mentioned with the very high levels of pancreatic reaction was caught by me. Now I get to see my blood work results online and had to contact the clinic and actually show up in person and say, I think this may be a problem, at which point lab tech spent all day trying to get in touch with the doctor to see what to do. But if I didn't actually check and advocate for myself, I would probably be in the hospital right now with IVs and feeding tubes, and we're still tracking my symptoms very closely to make sure that the pain that I am feeling doesn't escalate to that point. I'm looking for new doctors, maybe ones that can pay a little bit closer attention. And at the same time, in this confusion, I recognize the grace that I did catch it, even if they didn't. So for that, I'm grateful. I mean, this is what Lyme looks like. And in these moments of feeling unseen and having to advocate and push, I feel really confused. Along the way, I'm also listening to what this is here to teach. I'm curious what your thoughts and feelings are about this pandemic as it spreads, yeah? Because clearly we're in this together, as it's taking a really long time for medical systems and governments to catch up to how serious and debilitating this can be. So this is my blog, and I look forward to sharing with you along the way and hearing from you along the way. And I thank you for watching.